everyone. Welcome to yet another edition of the Women's Show here on Civic Space TV. Your moderator for today is Marion Kirabo, and today we are discussing mental health care. So this is the month of mental health, and recently the Ministry of Health released some statistics that were quite alarming. Apparently, 14 million Ugandans have some sort of mental health illness. So when the statistics came out, most Ugandans were like, oh, we didn't know, first of all, that we were that sick or cuckoo. But also, how is it that the numbers are that high? How is it that people are that sick? So with us today in the studio are people who are going to break down those numbers for us and really tell us what are the causes. Why is it that 40 million Ugandans have mental health issues? What is going on? What are we not doing right? So I will allow our speakers for today to introduce themselves.
Hello everyone, my name is Aromorach Sheila. I'm a programs assistant at Gallup Initiative Uganda, a space that thrives and works towards girls' leadership and education in the country. Glad to be here.
Nice to have you.
And my name is Janat, Kantalama, Katana. I'm a psychologist working with Safe Places Uganda. It's a private mental health service provider, and I'm honored to be here.
So as you can see, we have the experts in the house. So let's just dive into the conversation. What is mental health? When they talk about this thing called mental health, mental illness, what are people talking about? I'll start with you, Sheila.
All right, so mental health for us, or for me in particular, is knowing that I am well physically, I'm well economically, I'm well socially, I'm well culturally. I am simply well in all aspects of my life. Everything around me happening or, transpiring in my life is actually well. And I'm able to achieve, I'm able to live, I'm able to wake up. So for me, that, in a layman's language, would be mental health. Yes. For a child to even understand, that for me would be mental health.
Okay. Yes. So well-being, making sure that, your life is all together and everything is running smoothly.
Yes.
Janet, why don't you give us I don't know. It's your
medical.
medical. Yes.
So I also not make it complicated.
Yeah.
It is just the way someone thinks,
the
way someone feels,
yes,
and the resultant behavior.
Yes.
If you're thinking right, and you're feeling right, thinking is thoughts, then feeling is emotions, then behavior. You're behaving in the norm. Then that is mental health. Okay? And I want to emphasize that is mental health. That is the being. All of us have mental health. Okay? But we often mistake mental health for mental illness. Okay? That's where we have challenges. When people say mental health and then everyone is running, are you, No. The other alternative is if you're not thinking right, if you're not feeling right, if you're not behaving right, or you are not psychologically well adjusted, then you might have a disorder or an illness, which we call a mental illness. Okay? So those two are distinct, though we often interchange them when we're speaking. So just for clarity, we have to make sure that a person who is not in the good state, because everyone has mental health, just like physical health. Everyone has physical health, but we can have poor physical health. For example, if you're not fit, your physical health is not good. The same thing, if you're not, if you're anxious, extremely anxious, that means that anxiety is relating to how you feel and behave. So that means your mental health is not good. Is that clear enough?
Yeah, but then you see, whereas when I get sick, I get a headache, I have a fever, maybe I can faint or vomit. How does one know that they are not thinking right, or their head is not in the right place? How do you discern? It's not like your head suddenly stops working,
So very few people actually get to the point of realization they're not well mentally. Okay? it's because of the insight, the person to get to know they're not thinking right. They believe the thoughts they're thinking, they know the things they're thinking. But with self-awareness, if, for example, you know yourself, you know usually when you're going for this presentation, you're not this panicked. And then this time around, the panic is on another level. That is when you're very self-aware. That's when you can know or see symptoms of your deteriorating mental health. However, for mental illnesses, most people around us are the ones who often see that we are not behaving well, we are not thinking well, or our emotions are not in the right place. So that's why it's difficult. They usually see when it has at a level which is later than it should be. That when you see someone who is scared of leaving leaving their home, I'm just saying, that's just one example. That is when the people around them start thinking, but this person, nothing is out there. Why are they scared to go out there? So the people around them then notice that this person is not well. However, people who are self-aware is when you know yourself, you know the baseline of your behavior. You're deliberate about monitoring. Just like you see, you monitor your headache. You're like, today my head has not been in the same space, or a good place. Then maybe I question myself. Those are people who can easily get help before that situation deteriorates. But most people, it's the people around them that notice that the person is not okay.
That you're not acting normal.
Yes.
This thing of normal. Because, right now we live in a society that they always encourage us to go beyond the normal,
Yes.
The normal is keeping quiet about certain things, be vocal about them. So I don't know, isn't it difficult to discern? Maybe, Sheila, you can break it down to common man language. How do you know, for example, you maybe personal experiences, have there been times when you know for sure that something is not right upstairs? So is that a bad way for me to say? But something is not quite right with me, and I am not in the headspace that I am always in. Have you ever, what were the symptoms for you, or have you ever experienced it, or have you seen others going through it?
Yes, I believe I have experienced, just as Janat noted.
Yeah.
All of us are mentally healthy. So I believe everyone does have a particular, to an extent that they get to realize. So for me, it's speed. I'm a very fast person. So when something is not right, when I realize the feeling is not right, or there's a lot of pressure, or I'm very, anxious or excited or something, my speed will reduce. For me, that is it. Then also the headaches definitely come in at a certain point. But then also mood swings. All of a sudden I'm like, no. The energies get low. Yeah. So, and I believe that's like a similar pressure any other woman will go through. Yeah. Like those, women are, I don't want to, this might sound stereotypic, but no, we are pretty fast and hardworking and, quick. So when someone is not well, they want to distance themselves. They don't want to leave home, like she said. You just want to be in a space that would absorb your particular mood swing, especially for young women and girls. And for me, I think those could be the, very quick ways to understand that something is not happening to you very fast. Yes, then you can seek help in any particular way. Yeah.
And you find that you can't do your daily activities properly the way you used to do.
Yeah.
So there's always this thing of for most of us, and considering the stigma around mental illness, mental disorders, so the first thing that comes to someone's mind is, most people think that for you to have a mental illness, there has to be a missing, for the lack of a better word, a wire. You have snapped.
That's the word.
That's the word. And suddenly you are someone who is a bit weird and strange. No. I want you to give us so help us understand this issue. When is someone mentally maybe sick or going through depression, or maybe has a disorder like bipolar? Is there like a spectrum of okay, let me say, like how for us, when we're studying learning disabilities, there is a spectrum. There's autism, there's dyslexia, there's what is there a spectrum for mental illness also, that you this and you that at this time? How do I differentiate? Let me say I'm just going through depression, I'm very sad about, I'm grieving. Then there is, you're actually crazy behavior. Yes.
Okay, so definitely classification of mental illnesses follows some set standard. There is something that we call DSM-5. That is a tool that is used in diagnosis of mental illnesses. It is a widely adopted tool. Okay, this and even diagnosis, getting someone to know that you're actually getting through depression, it's always advisable that you first seek professional help.
Okay.
Because all these emotions we're talking about, as I told you, we all have mental health. We all have emotions. So you will definitely be sad. You'll definitely be anxious. You will definitely be perturbed. You will definitely be angry, but to a certain level that we can manage. But when our emotions are unable to manage those emotions, I mean, we're unable to manage the stressors that in the environment, that we have been overwhelmed. Okay, and it can't only be a day. Today I had a bad day. No, you can have a bad day with bad emotions, but have no mental illness. Okay, so there are parameters in those in that classification. But usually, if you've spent 2 weeks, beyond 2 weeks, having the same feelings, emotions, and behaviors, but also you also have to know that there should be noticeable. It has a behavioral change. No, it's not just the emotions manifest, the thoughts manifest in behavior. What we see is the behavior. Okay, so we will see that there's a change in your behavior. So, for example, if you are a very outgoing girl, and for the past 2 weeks and more, you have secluded yourself, you don't want to talk to anyone, you don't want, you've lost interest in the things that you are interested in. You are not the outgoing person that you are. Your appetite has changed. There are markers that you can easily snap. Your moods are up and down. The moods are not stable. If before you were level-headed, this time you're consistently, or even some conditions that the emotions are. 1 minute you're very happy, next minute you're not happy, or you're consistently very happy when you are not that before. Okay, there is a state you were before, and then a state that you go into that. So those are the indicators. But for you to come out and say, I have maybe a depressive disorder, you have to have got a diagnosis.
Okay.
So we don't throw it around and say, I'm depressed. It is an illness, actually. Or I have anxiety disorder. It is. But you can be anxious. Okay? You can even have panic. But it doesn't mean that you have a panic attack. Or it doesn't mean you have a panic disorder. They are different. So it's not that, we're just thinking. There is a criteria that can be used by the professionals, and the assessments, they assess you and then give you your diagnosis and say, no, this time round, things are like this.
So at what point do I know that I need to get a diagnosis?
As I have told you, if you're self-aware, if you're self-aware and you know yourself, if after 2 weeks, the thing is not going away, please seek professional help.
Okay. I think you hear that
one. If by 2 weeks of you're sad, there are circumstances that are unique. For example, if you've lost a loved one, the grief might even take a month, 2 months, 3 months. It might get out and in. But if the grief is persistent and not going away, even grief itself needs professional help. Because that is a circumstance that is taxing your emotions. So you need to go see a grief counselor or therapist to help you through that situation. There are circumstances that happen, or you've just been through a traumatic event. Okay? So there are emotions that will come along that event. Okay? But if the emotions cannot go away within a certain period of time, like for example, 2 weeks, you survived a car accident and you still can't enter a car, then you need
help.
I
think everyone understands that. So beyond 2 weeks, please see a doctor. But let me dive into the New Vision report. So please just give us statistics. What is the status of, let me say, how bad is mental health or mental illness in Uganda? How bad is it? Do you think do you agree that 14 million Ugandans actually have mental health issues, or you think it's a hoax? Or just give us the status. But also, when you're giving us, because this is the women's show, we like to specifically look at women. How bad is it for women? And do you think that, okay, we'll go into other questions, but that specifically pointed to it, how bad is it generally, but how bad is it for women?
All right, so I, of course, just like any other Ugandan, those particular numbers, caused a lot of
alarm.
And one day
sitting here and just the person next to you, actually.
Is Janat? Okay, but then, of course, very true is that definitely just like any human being that has lived these 2 years of COVID-19, and we are recovering as a country. I think the statistics that were given earlier were before COVID-19. So, and you know how COVID-19 hit so hard in every particular group of people. And now when you can imagine women, with all that was, that happened, transpired, early marriages.
This report was for 2019?
Yes.
So COVID-19. I'm just imagining into COVID.
Yes. So 2020 is when we had COVID hit.
Yes.
So 2019, so before COVID.
So I'm just imagining how it is after COVID.
After COVID. So with all that, with all,
Don't you think all Ugandans now have a mental health? Because COVID was so bad,
So ideally, just that statement, I think all Ugandans have a particular, status of mental not being well.
Yeah. No, we were not well during
there is even till now we're still struggling to get back on board. So I must say, when we are to look at what women went through during COVID-19, in particular women, girls or young women, and any other children, and all those uncertainties that came across, rape, GBV, we had deaths here and there. Then elections also brought a huge number of things.
And
exactly. So when we are to look at those, then we can tell how unwell really people went. People were. People
not mentioning the economic crisis
till now. So when we can use that really to be able to understand how unwell
our population.
Yes.
So you feel like there is a correlation between, let me say, like you're saying mental health issues just don't come out of the blue. Like our environment does affect how well we are.
Super much.
Like very, a jam, like jams affect how
what causes diseases, jams.
So the social factors are our jam causing diseases. Okay. Janet, please tell us, what do you think of the statistics?
Of the 14 million?
Yes, as an expert, do you think it's hogwash, hyperbole?
Oh, yes, simply.
I actually
exaggerating.
No, I actually believe there should be more. There should be more than 14. It is just we don't have a conclusive or a countrywide study that has been done.
Because I'm wondering where they even got the 14. I've never filled out a survey about my mental health.
No, the surveys are done from at least the people that are seeking help. Okay,
14 million people seeking help.
So what you have to know is that 14 is the people who have sought
help.
There are people who have not sought help. There are those who have sought help in the wrong places and have not been recorded. Okay, and then even because of the inconclusiveness of the studies, if you go down and get smaller studies, the figures are even higher. That is that 14 comes around 32%.
Yeah, but I always think that that's even a lot, because how we always say that mental health is okay. You are an African. What the hell? Why are you even looking?
Talk about mental health.
Why are you even looking for? I'm shocked that 14 million people actually wish. But then the other thing I think is that by the time they reach out, it must be really bad, right?
So what happens is those who are reaching out are usually from moderate to severe. Okay? Those are reaching out at moderate to severe. And also you have to note that it's not only one illness. There are also a range of illnesses. So when we're saying 32 or the 14 million Ugandans, it's not that everyone is depressed. Okay? You'll find someone who has a substance use disorder, that is an addiction. You'll find someone who has a bipolar. You'll find someone who has a neurodevelopmental disorder. You'll have someone who has depression. You'll have someone who has anxiety disorders. So all those combined. It's not that it's one disorder that is making up 14. And so when people look at it and say 14, they say, you mean all these 14 million people are depressed or they are, you know? No, it is not.
Yes.
Okay?
They have different things going on.
Also the severity. That's why you say you can't see that everyone is severely sick. Some are moderate, some even mild. They seek help when they're in the mild status. If, for example, the family has a history of mental illness, so they easily identify
because
symptoms,
they have that self-awareness.
Yes, self-awareness. So it doesn't mean that everyone who has gone for treatment or who has been considered in those statistics is severely ill. Okay, who are the people that you think? Everyone, when you talk about mental illness or mental disorders, everyone thinks of the extreme. Okay. We have mild, moderate, and severe. Okay. So that 14 million should just open our eyes. And let us be aware and alive to the facts that we are actually sick. Okay. The people are suffering. Okay. So I believe that if they did another study, the numbers will be high or higher than that which was reported on Monday. Okay, they will definitely be higher. So, for example, I'll give you an example. There was a study that was done during COVID of the mental state, the psychological well-being of mental health service providers in the regional hospitals in Uganda.
The people who are offering
in Uganda. It was done not only in Uganda, they did this. China, there were comparative studies, okay? But they considered 8 referral hospitals in Uganda. And they included the mental health service providers and the support staff. And it came out that 21.5 of the people who are offering those services
also have
during the pandemic had psychological distress. Psychological distress is the stressors. So if the things that are distressing a person's mind are not handled well, the chances of them going into severe illness are high. So if we did only that, we did a small sample of the mental health, the health workers, and the figures are 21.5. Those are few people considered. So what do you think will happen? Or I'll even give you an example. They did there was another study in around 2017 of ginger and iganga. And the figures came to around 60.1 of people who had mental disorders.
Wow.
That was just a sample. So I tell you,
in one district.
Ginger and Iganga. So I tell you that statistics of 14 million are not far-fetched. They are not far-fetched.
They are very true, huh?
Yes. And they might be higher because the ministry was planning to do a study, I think, post-COVID. We are eagerly waiting for those statistics.
I think I would maybe faint after seeing them because those 14 is already too much for me. But now, want to go to specific and dissect. Did they go into how it affects men and women, how those statistics are distributed between men and women in that study? Or they didn't go that far?
There are no, apart from depression, which is also depression, which was about 5.1 for women and 4.6 for men, which showing that women are higher.
But not so much.
It is a big difference. If you say 5.1 and 4.6 or 4.4, it's a big difference.
Okay.
But also when you look at the World Health Organization, the global statistics, you see that depression in women is higher than in men, just like suicide is higher in men than females.
Yes.
So there are those differences that come
which
here
is funny, because then you expect the person who's more depressed to be the most likely person to kill themselves, to commit suicide, sorry, but then the other one who is less depressed is the first person to end it. Why would that be?
I think you have to note that our men, at least in the African and Ugandan setting, rarely seek help for issues of mental health. Okay? That they rarely seek help, that they only exhibit that at the tail end when they have died by suicide. Okay? So the fact that we got the statistics are got from people who have sought help or who have reported to have an issue. That's why you see that when they're treating, when the depression rates come in, the women are there seeking help. But these ones, the statistics of death, the person has already died by. So there is that culture of not seeking help.
Yes, but it's worse in men.
By the men.
Yeah,
okay. So the men have, they're the patriarchal, they are the strong, and they're the ones who are
can't cry,
can't break down. And then also our society expects them, that it puts a burden on them not to, So that's why the figures for them suffering could be that they are not showed or they do not come to that level.
Okay.
So yeah, but they suffer the same.
Okay.
I mean, we all suffer, even an environmental situation. For example, a loss of a child will affect both the man and the woman. You've lost your child. So the woman will be able to cry out and, she will experience the whole range of her emotions. But what will the man do?
Probably say, oh, it will be okay. He usually does the consoling part. It's like, it's not, it's actually like you're the one who lost a child.
Or go drink.
Go drink, hang out at the bar.
Then also I wanted to simply add to why I believe the numbers are funny for both men and women. I also think women are really, we are taught and we practice the culture of being very open with each other. You find women in a saloon having a very normal conversation
about everything,
anything and everything.
What my husband
exactly. And so you find that's like a healing process for them. But then a man, you're not supposed to cry. You're supposed to be violent. You're supposed to be strong. So this stereotypical,
you can't even tell your friends.
Yes, that would be an abomination. How do you start crying yet your child has passed on? I mean, that people shouldn't see your tears as a man. But then as a woman, it is free. You cry.
You can express. You can wail. You can even roll yourself. I've seen women roll themselves on the floor. And
exactly. So you find it definitely. We will continue having those kind of statistics because of how society has decided to structure the men, and yet the women are actually benefiting from all that the environment has happened or provided for them towards mental health.
But this is it for particularly depression as per se, or does it also, are there other disorders where there's a kind of an imbalance? For example, let's talk about eating disorders. Does that affect women more?
I cannot rightly tell you the statistics of those regarding gender. It needs further study. Okay, but you see there are things that you can also see. For example, substance use disorders. Substance use disorders, that is the drinking.
I guess that is men more, right?
Exactly. because you also have to look at the structure of our society.
It also plays.
It plays a role. We are beings who are living in an environment that is has different forces. Okay. So the way she was saying that a person, they would drink more. The gentleman will say, call up his boys and say, can we meet here? The person will go drown his sorrows and, and they will be cheering him on and, smoke his joints and he will feel happy and, come out of that state for that moment. Okay, then that it will hit again. And he knows that what he did the other day helped. Then he'll go back to the bar and drink. So when they get into addiction, substance use disorders, that is that is one way they are coping with their distress in other areas of life, and the occurrence is higher in male than female.
So. Obviously. But So we're going back to, again, this is the women's show. So we are all for gender equality and women. So do you think that there's a correlation between gender inequality and the state of mental health or mental illness? Perhaps in this country, that the social injustices that women face, do they somehow affect mental health? Could that solution for solving at least mental health issues in women and maybe men, because we do know that gender injustices affect both men and women, like we already said, men's inability to cry, to let out their feelings, to talk about what challenges are going through, leads to higher suicide levels. Perhaps if we had a society that was not so, let me say, gender role based and forcing men and women into some kind of box of what they ought to be, maybe would have solved half of the problems causing mental health. Do you think that is true?
Yep. I would say yep like 1,000 times. So I recently updated my playlist, my song playlist last week, and I came across a Luo song, Amana Choli. Yes, from Noya district.
Shout out to all those that are watching the show.
Yes, so there's this song by Eddie Wizzy called Apoya, and Apoya in English means madness or mental illness, you know. So and then, so deep in the song, you know, when you to listen and directly translate, so he speaks towards people having different degrees of mental illness. And then he breaks it down. So my understanding, of course, it's really hard, a song, but then when you break it down and try to understand it like any logical person, you would figure out that there is a lot that comes from environment or society that triggers that madness that he calls, right? And very much so, all the happenings around us, for women especially, does, you find it will, short term, long term, lead to depression, stress, you know, elevation in stress. You find there's stress eating for students, female students in school. You know, you find a child and then she has grown in the school. At times it's really stress eating that would cause that. It may not be well-being and all, but there's a lot that she's going through. Probably now, right now, we know the economy is really hitting hard, and you find students are returning to school, and you find this girl, she's been sent with only 1 packet of sanitary pads, or with only 3 books, because of course, economy is hard. Parents cannot be able to provide as they were providing for a girl. Definitely, that's going to haunt her. Periods are going to come, she may probably need 2 packets a month or 3 packets per month, but she cannot work through that. What's going to happen? Definitely she's going to be depressed. She's going to be feeling unwell throughout. So you find there's a lot coming down to GBV for women in particular. Definitely. Without people may argue.
No, I don't think.
There's always that percentage that will argue.
No, violence.
So yes, violence for women does cause a lot, short term, long term, a lot of depression, a lot of anxiety, a lot of things around not being well. So when I was going to office this morning, I met on my way, I used taxi and border. So I saw about 3, I think they were at severe level, because, you know, they were unkempt hair, dress code, and our office is next to Vitalika Hospital. So, but then there's one I met here in Tinder, then there were like 2 around that area, and then the 2 were women, and then the 1 is a man. So I was like, oh my God, oh my God, oh my God. And you find this is just like she said, there's different levels. And of course, by the time someone gets to that level, probably society hasn't been open. They actually do not know what mental health is. You know how we are questioning and we're so worried about these figures? It's because we actually don't know what mental health
is. You know, we just take it for granted. I think, oh, that person is just like that.
It's a white man's thing. It's not ours. So you find it's not an open conversation. And conversations many a times are left for the men. So imagine a conversation around mental health and there's no woman a part of that conversation, or there's no girl or female student are part of that conversation. We are glad we have Janat, female representative, you know, into that space, who was part of the press conference that time before the release. So that's amazing. But imagine, this is just like 1% probably, or 0 something percent of the women involved in mental health conversations around this country. So you find whatever happens around in community for school children, for women, for young girls who, you know, became mothers before their 13th birthday in these past 2 years. It's been crazy for them. And this is something that will continue to live with them until they seek particular kind of help, which they do not even know, or which parents may feel, it's expensive to go to Janat. You know, that stereotype. Oh my goodness, mental health or wellness or care is pretty expensive. Or they don't even know that, oh my goodness, you can actually bank on the law that is in place, you know, to be able to seek mental health, because the law is really clear. Mental Health Act of 2018 is really clear. There is you can receive mental health care in any particular healthcare
at no
space.
Cost.
That's the question for Janat now. But yeah, so people are not aware, and you find people, for women, it's even more difficult because they're already not aware of particular things that happen around them. So it becomes 3 times tricky for them to be able to be healthy mentally. Yeah.
So Janat, Sheila talks about so many things.
Yes.
So many, I don't even know where to start from. But I'll start from the issue of accessibility.
Yes.
I have personally sought out mental health care. You know, I have tried to procure it for friends and you know, family. We've talked about the causes, we've talked about what. But now when you know that you do have a challenge, or you need to work things out with someone's help, like a therapist.
Okay.
First of all, in the private practice that you do, you people charge 150 for an hour. I mean, by the time I see Janat for the first time, I'm just sitting there. I'm looking at this woman. Can I trust her? Can I know? Is she going to judge me? Those are 30 minutes in. By the time I even start open to say my name, the hour is done. You know, and studies recently came out. I mean, the average Ugandan earns about $42 per month.
Less than 1 million.
Less than 1 million. It's about 200. So you're asking me to give you all my salary. You get, you know, 150. All my salary. It's about like 240.
Actually, the services are not so expensive. I even said it the last time I had space to talk about it. It ranges between, the private ranges between 50 to 300. 300, that is including, you know, if it's an assessment. 50,000, you will see, you have a consultation. 50,000, you have a consultation somewhere. Okay. You also just maybe need to know where to get, where to get those services. Okay. So that is in the private area. Okay. So for private, there are organizations that we belong to. For example, there is Uganda Counseling Association. Okay. It is an umbrella body for all counselors. At the moment, it's also housing psychologists. And also registered organizations that offer those services in that sphere. Okay? So that's like, for example, Uganda Counseling Association. If you're in any part of the country and you need to talk to a counselor, then you can reach out to the Uganda Counseling Association to assign you a person who is in that area. And as I've told you, the costs range from 50 to 300. 300 is high end, you know, but there are those of 50, 70, you know, 80, 100, depending on the different, because it's private.
Okay? But I still get the same quality.
Yes, yes, just like pricing. I'm telling you, 300 could be an assessment that is needed for maybe court or something, you know, so because I'm saying that is all the range of the psychological services that are being offered. Okay, it could even include consultation and medication. So I've given you a wide range. Okay, so that you can know you can fit. You can fit within those. And then for quality, of course, with umbrella bodies, if you do not fit the standards, then you will not be included.
Okay.
So for the private, that is it. There are several private mental health service providers. That's why I'm here. Safe Places Uganda is one of them. But there are also other private hospitals. The hospitals that are offering general health care also have a unit of psychiatry.
Where would someone go for cheap available and good
cheap, available,
good quality.
and
Good
good quality.
yes.
I don't know about cheap, but maybe cost effective.
Okay, cost effective.
The hospitals, if you want to go to Kampala Hospital, there are services there, Nakasero Hospital, Platinum, that.
Okay. Okay, so thank you. We will continue after the break. We will continue the conversation after the break. Hello, welcome back from the break. We are back into our conversation with Janat, and she was just discussing with us how we can get cheap, affordable healthcare services.
I told you about the private offerings, that the people that are offering the private services, but I hadn't told you about the government.
Oh.
Okay, because the government also has psychiatric units.
Oh, yeah,
starting from health center 4 to referral hospitals. That comes to about 28
Like
units.
when you talk about referral hospital, do you mean like the Mulago and what? And
yes, but you see there is Mbara Referral Hospital, there is Hoima Referral Hospital, Fort Portal Referral Hospital. There are referral hospitals, there are around 8 there.
So I'm assuming all the government referral hospitals have a mental health care section?
Yes, they should have a mental health care section.
Okay.
Yeah, some of them were taken up during the COVID period, but they're now back on. Those are the areas they were using to,
Test
hold
people and
hold some COVID patients there. But now they should be fully functional.
Okay.
And also health center 4s. At least a health center 4, you'll find a mental health practitioner from government to that level. But we also have the National Referral Hospital, the mental health referral hospital, which is Butabika. And I keep telling people the services in Butabika are wow. Yes, they are wow.
Are they
yes,
you know,
they are.
Ugandans want free
They
things.
are, yes. They have private wings, but they have the free services.
Okay.
For every Ugandan that can access them.
But you see, the problem with Tabika is the stigma around it.
Yes.
So people be thinking that, this person has gone to Butabika, they must be crazy.
But let me tell you something, that now that we are normalizing the conversation about mental health and mental illness, we should also normalize going to Butabika. Because if you judge me for thinking that I've gone to Butabika, yet you could be among the...
That's what you think.
So we also need to destigmatize the Butabika place.
Yeah.
If I don't know if any of you has been to Butabika, it is a beautiful place. It has green, it has good structures, it has professionals. The whole range of professionals. So yes,
the picture I must forget is like people running around,
the one we're watching movies.
I know, right? The one that we watch movies.
You should challenge yourselves to go and visit. It is free. Go and check it out and see the place that we are talking about. Yes, we are offering private alternatives, but also the public alternative should be taken up. At the end of the day, we are fighting a very big elephant. If we're talking about 14 before COVID, then which numbers are we looking at post-COVID? Remember, some of the causes, most of the causes for mental illness come from the environment. So how is the environment that we are facing right now? How is the environment? How is the levels of poverty? Because they have direct correlation with the mental illness. That's why you see that in low-income countries, the prevalence of mental illness is higher than in high-income countries. That is the fact. It's given, okay? We're looking at things like access. So if we cannot break the barriers to access, that means that the prevalence will also go high, okay? So we're looking at things like the causes domestic violence. So if we are not handling, we have to destigmatize our Butabika, and we provide the access and also avail the private alternatives that we are giving, so that at least those who are in the know and are seeking those services can get them, and then get help, get treatment, okay, and at least live productive lives. Yes.
I completely get you.
So
now we have been talking about, and you pointed it out, and this whole issue of mental health being a Western thing, a Western concept. I mean, yeah, in Uganda, at least I've seen, been with relatives. Most that we do, if you have a problem, a very big problem, you're stressed, you're depressed, you go to church, you pray about it, and you let it, the good Lord answer your prayers. And I've even had women say that, no, for me, those things of therapy do not work for me. I don't even see what talking to someone else about my problems is going to do for me. I will just take my burdens and to the Lord, hand them over, and He will deal with it. The Lord is a miracle worker. What do you say about how we as Ugandans handle our mental health issues daily,
So I think really we are a growing country, and we are a country that is becoming aware of how fast the world is moving. So whatever newness that comes on board, global village, we are slowly adapting to it. And so conversations around mental health are similar. It's a newness into the world. We have, of course, been experiencing mental illness, but then our approach has been really local and religious, the way you've noted. While we were in conversation with Janat earlier on, and she spoke towards people first go to the shrines, the traditional healers before they actually come to them, right? So we have been handling them in our African way, culture way, or clan meeting and what's happening to this person. But we haven't appreciated what the new technologies or the creative industry is bringing, to help overcome mental health. Things such as visiting Janat once in a while and figuring out this and that. So really, we should expect such conversations that this is a white man's thing. And yes, it will be after some time, after Janat and her team has brought more numbers for us that we'll understand. It will still be after we have more people like Janat, more female in the space to be able to understand this or help the rest understand it. It will be after some time that people actually know that mental health is not only going to Butabika, getting mental health is only going to Butabika, but all this that we have discussed, knowing that this and this actually is part of being mentally well, or this is actually being mentally ill. Then that is when we shall understand this is a conversation for Africans and the white man, and a conversation that affects, even as now we don't see it affecting us as a country, but if we are finding out that people do not want to engage in conversations such as mental health, how will people engage in conversations such as politics, such as economic growth? Because all these are, environmental related. Yes. Yeah, so if people do not understand what mental health is, then how much will they input in these other conversations that form part of society, that form part of, gender equality, part of well-being for children? Yes. So till we understand, or till mental health is redefined for people, then we shall stop the stereotype around it being a white man's culture.
Okay.
Yeah.
So Janat, you're the clinical expert, and I have had stories of how the African way of handling mental health, but maybe I'll tweak it just a little. That issues like schizophrenia.
yes.
People with schizophrenia, how in some cultures they're actually seen as people who can see visions and
hear voices.
So they're talking to the spirits. And
Janat knows all of that.
I think you've come across that,
Definitely.
that in the past, actually, people like this were glorified. The spirits have visited that person and they have possessed them. And
they're speaking in voices.
They're speaking in voices
of the people that have deceased.
Yes.
They are seeing things. They're communicating to their ancestors.
Exactly.
Or they have been bewitched to amount to nothing because a person is sick. They say, someone sent something to my son or to my daughter. That is common encounters with us.
Do you still think that past affects the work that you do? How does it affect the work that you do? The beliefs that people come to your office with about, about whatever they decide, how they decide to explain. How do you start to debunk?
First of all, we can't practice in exclusion of the environmental norms or cultural norms. So some of those things have been in our cultures or ingrained for a while. That mental health coming in and explaining mental illness using science will take a while. Okay, but that is a journey we have embarked on as health service providers, but also as the community. I mean, as the society. Now we're having more conversations on mental health than prior to this. For example, this conversation, at least someone who will listen to this episode of Civic Space will go away knowing something about mental illness, mental health. Okay? So, but for people to completely do away with their beliefs, it takes systematic dismantling.
Yes.
So, for example, statistics, 80% of people who seek help from hospitals for mental health care first go to their beliefs. They first go to the witch doctor, if it's a pastor, they will first go there. That is 80% of those who come, eventually come to get the help, have explored all those.
Until they have all failed, then he says, okay, let me try science.
Even when we're providing this, the science-based care, even you'll find someone saying, but these things, you guys are insisting that this person is sick, but I know my son is bewitched. If I took him to a prayer
even when they have brought the person.
Yes, because you see, we all don't grasp at the same time.
Yeah.
We all don't grasp at the same time. And because of the intangibility of mental health, it's not like a leg, a broken leg. It's not like, that we don't touch it and feel it.
Yeah,
and,
it's not seen.
It's not seen.
An invisible thing.
Then it is harder to convince a person about things pertaining to it. So what we have to do is continuously sensitize. Even people who come into care, you will find that one part of the family believes that actually the care is going to help. Then another part of the family says you're wasting your money. Okay, so it is a continuous. If the person is on medication and they become better, and then people will come to believe, and someone will say, no, I had my auntie, and we got her treatment, and she's doing well. She's actually functioning. She's getting a job. And then maybe the other thing that is deterring people from embracing the science is they believe that people don't get well. Actually, people get well.
Have you come across cases where people don't get well?
Yeah, there are those who, when it's like they've caused permanent damage and their functioning will not be restored to normalcy. But
what would cause that?
That, for example, I will just give you an example. If you have a leg wound, which you don't treat, and it eats into your bone, the bone will be cut off, isn't it?
Yeah.
So if you have an illness that goes untreated,
really, there's a way it affects the brain and
yes,
continue. Oh, really?
Yes.
Like I can have acute depression and it eventually destroys my brain. Is that what you're saying? Okay.
Because it's already depression has altered the way you're thinking. Yes, the communication pathways in your brain, the neurons and whatever, it has already altered that.
Yeah.
So imagine an elastic, you keep pulling at it. Won't it eventually break? Pull at it, for a long time without getting it
eventually snaps.
Yes, without getting it into like
back into its original.
Okay? Yes, into its original state.
Yeah.
So there are conditions that can be curbed.
Yeah.
Depending on the circumstances, how long has the person had, which condition is that, and then the person are they taking medication, can they adhere to the treatment, and then people will be functional, go about their life. Normally, you won't even know that the person is sick. The person will just be taking medication, like just a diabetic person taking medication, but they continue and be productive in their lives. So the belief that people don't get well also hinders people's belief in the overall care. Towards mental health. That's why it's easier to divert to the other. And we're not saying that going to a pastor is not helpful in mental health.
I was actually going to ask that there are other unorthodox ways apart from seeking a therapist. The person can say, I went to the pastor, I feel better now.
Yes, because you see what happens at the end of the day, that we are dealing with emotions, thoughts, and beliefs. Okay? So we're dealing with a person talking out and a person trying to help you piece together or get you out of that situation. Okay? So, yes, going to a pastor, because we also do spiritual counseling, there is a component of spiritual therapy or counseling. So, yes, going to a pastor may or may not help you depending on what you are dealing with. So, for example, a person who is already seeing a snake in his leg, or a person who is seeing, hearing voices telling him to jump off a hill, or a person who is already
who cannot sleep in the house because
that is severe. Now they will go and they tie you down.
I'm always saying those things. There are people who come and there are actually people who come to church and start giving, scenarios of them hearing voices and, seeing snakes and blood all over the place. Could those big cases, those so-called demons that we think are attacking the home, could they be maybe cases of schizophrenia?
But those are hallucinations, for example. You can have extreme paranoia, someone is coming at you with a knife, okay? Or you can see or hear things that other people are not seeing, You can for example, you can feel pain, which is not physical pain. You can have, so some of those conditions, yes, manifest in what people know as demonic attacks, but they are symptoms of a sick mind. Because it's only a sick mind that will see what you're not seeing. Okay? So what I was saying that some cases, for example, if you've been into a depression and you go to, which is not a severe depression, or you've had these chronic phases of depression, and the chronic, they keep recurring with intensity, and you have prayed. Because yes, go to the God that you know. Go to the higher being as you know them. But if it doesn't help, then know that there could be something else. So we're not saying that you shouldn't go to we are spiritual beings. You shouldn't go to your pastor. If you're believing in a traditional healer, yes, just like people have several reasons for going to their traditional healer. But know that some of those conditions have been proved to be able to be treated using science. So you bring a person, instead of telling the person at church for a month, no improvement, another month, no improvement, because our God is a responsive God. We pray and He hears us and He answers. So if for a period of a year the person, God hasn't yet answered us, maybe you should try elsewhere. Hence the statistics of 80% first try somewhere else before they come for treatment. So I'm not disputing. I'm not telling you don't go to church. I'm even not telling you don't go to whoever. But I'm saying that perhaps that solution you're offering to that problem might not be the right solution. So you also should try science-proven interventions.
Of course. But would someone necessarily be cured through prayer? Of schizophrenia through prayer?
No.
And maybe before I go to you, Sheila, could you give us, Janet, could you give us some of the disorders that we take for granted, but you have seen so many people living with them and they just don't know, and maybe they think it's demons and stuff, but when this person, I think the most common thing that I know has been bipolar disorder, because I have seen a couple of students who have struggled with it. They have to be on medication all the time. When they're not on medication, they behave in equal extremities, very happy, very sad. Sometimes they become violent, Those are the ones, particularly, that's one disorder that I have had and people have struggled with. There are others that people live in. Actually, I've just sat here, just thought about actually maybe the people I'm hearing who hear voices are actually schizophrenic, and I've never really thought about it.
And that's a good thing. Now you're going to go read about it and see the symptoms and the signs of schizophrenia, and then you will get to know it more. So it will be explained to you. Once you go and see a person, hallucinations, what does a person do in hallucinations, what is paranoia, extreme paranoia, they make sense once you get to know them a little bit more.
Yeah.
So, but there are other conditions. There are as many as the DSM-5.
But just give us the common ones, the ones you see people
anxiety disorders. And they mistake it for anxiety. Everyone can have levels of anxiety, but it becomes a disorder when it starts affecting your functioning, your everyday functioning of your life. So, okay, there are anxiety disorders, and they also range. There are panic disorders. There are compulsive disorders.
Is that the so-called OCD?
Yes, people say I have OCD because I arrange things in order. They don't know actually the magnitude or how limiting OCD can be.
Okay. How?
That
if I'm just very neat and I like to
it is
put things
not about
together.
neatness only. Oh my goodness. OCD.
That's why people say that. I'm so careful. I'm so neat. I like to put everything in order and have everything in order.
OCD can make you lock and open your door before you go out like 20 times. Have I locked my door? Then you go reach the car and say, but did I lock my door?
Then you go and
isn't that life limiting? You keep So there are things people just throw them around. OCD, because I'm very neat, I'm a neat freak, so I might be OCD. OCD even like having life in like patterns, So imagine that if you do not walk from here to the door, like your life is in patterns that do not make sense
do not change, and when they change, something is terribly wrong, and you just don't want.
And you freak out.
Yes.
Like for example, if you left your car key on the table and that car key is not there, you could have a mini breakdown. Imagine how that life limiting that is. The fact that it's just a key. Someone will just say, "Oh, I misplaced my key. I go and get it." So it's not just what we are making it out to be. It has far limiting symptoms. That is the OCD that you're talking about, obsessive compulsive disorder. We've talked about bipolar. We've talked about borderline personality disorders.
Explain that a little more, because I have a feeling a lot of people walk around with borderline personality and they do not know what it is. I also heard of things called, hysteria, what. There's so many things.
You just have to interest yourself and get more into knowledge. For example, borderline, it's a state where you can easily flip from one to another. It's not bipolar. Bipolar, you are either in manic or depressive state. But here you have extreme anger to the reactions you have to circumstances do not equal to the stimuli. Okay. So for example, maybe we can be having a remote in the sitting room, and then you get because someone has picked the remote that you previously had, you want to get a knife and kill them.
Wow.
Are you getting it? The reactions to the stimuli
is just
that is
extreme.
Presented to you. Yes. And the person says, I even don't know how I can control my anger. I just get angry out of the blue. They don't understand
why they're so angry.
Why they're reacting the way they are reacting. So these things are not easy. How we see them and we know.
There needs to be so much. We need to have an awareness. I think people need to understand, because most of these things they just think I am like that. I've been like that since I can remember. So, but I think we have to give this a wrap. So, any last words for any of you? Sheila, let's start with you. What is your parting shots for the audience? What would you want them to know? Maybe changes they can make. What can they do, in this month of mental health care?
All right. So this month does call for us to be together in helping fight or calling out mental illness and causes of mental illness. That's the theme that globally people are running by. The conversation around togetherness for mental health. And so mental health doesn't only take, or mental wellness does not only take Janat. It takes me, a lawyer, it takes Marion, it takes the market women, it takes the children who are going to school right now. It's a conversation and a practice supposed to be for everyone. And so everyone should take personal initiative to be able to understand it. And most especially, people should learn to have women a part of these conversations. I mean, that's something I can say every single time. I could say at the start of this conversation, the last, women should be involved in these conversations. If we didn't have Janat,
You could have someone else. Another woman.
I held it out. It would be another woman.
Yes,
but then
have
really,
another women. The women are there.
That's what we need to, work towards. Take a personal initiative. Have women a part of these spaces, and do not wait for Janat to come and say, "Hey, you're mentally not well. Come visit us." No, take it. There's so many ways, really, that you can, get through this. Women normally don't stop going to these salons and, talking all these things. You're part of the healing process.
Okay, Janat, your parting shots to the audience.
And they are going to be brief. I want to thank you for this opportunity. To thank every other person, stakeholder in the media that is giving us an opportunity to talk about mental health, and especially the Ugandan situation regarding mental health.
Which is very worrying.
Yes, it's worrying, but we're also doing something about it. Every person can be charged with the responsibility of breaking the stigma. You can start by educating yourself. Get knowledge and information regarding mental illness, mental health. Okay? And then as an individual, do that which you need to do to keep healthy mentally. Okay? Because there are things that you can do as an individual. Then look out for the people that are around you. Because you have to be your brother or sister's keeper. Okay? Be your sister's keeper. Know how your sister is doing. And then after that, then we have conversations that matter. Unashamed conversations about mental health. And then seek help. Okay? Everyone, if it's your loved one, get them help. If it's you as an individual, get help. So that we can deal with this pandemic. Thank you very much, Marion.
So thank you so much for having us, for sharing your knowledge with us. And that was it for today's show. Catch us again next time on the same day, same time, here on the Women's Show on Civic Space TV. You could also follow us on our social media accounts, Twitter, Facebook, and Instagram. Bye.